CPT JJ-CPV Introduction, page 12, part 3.
Introduction.
The interval between the release of the update and the effective date is considered the implementation period. The release of the update every year is at the end of the summer, so which means more or less September. And the effective day is January the 1st. So from the end of September until January, that is considered the implementation period, all right? Can you read the next one?
This implementation period is intended to allow physicians and other providers and payers and vendors to incorporate CPT changes into their systems.
Right. So they give you this window, right? So you can get ready for it for the next year. So they give you the codes or the changes in September. So they tell you you have until January 1st to put this into your systems and to get ready, because January 1st, these codes are effective, right? Okay, that was a little theory, and now ready, set, go. We're going to do the problem, okay? All right, so the problem is CPT JJ-RVA, page 251, exercise 32, and this is a level 2 exercise, and it reads like this.
Surgery, musculoskeletal. Patient presents to the emergency room following a fall. X-rays were ordered for the lower leg and results showed a fracture of the proximal left tibia. The emergency room physician performed a close manipulation of the fracture with skeletal traction.
Right. Let me read it again. It's a surgery section of the CPT code. It's a musculoskeletal, and the patient presents to the emergency room following a fall. X-rays were ordered for the lower leg, and results showed a fracture of the proximal left tibia. The emergency room physician performed a close manipulation of the fracture with skeletal traction. Okay, so that's the procedure. Now we're going to come to 3, so you can pause the video and give us the CPT code for this procedure. 1, 2, 3. Okay, the answer is 27532-LT. Okay, 27532-LT. Okay, if you got that code, congratulations, you can go to the next video. If you didn't get it, let's give you a few tips. All right, first tip.
Tip number 1. Start with manipulation, dislocation.
Right. When you go to the index, you look for manipulation, in the M for manipulation and dislocation. Okay, the tip number 2.
Level 2 difficulty. This procedure needs to include a modifier for the left side of the body. With parentheses, it reads LT. Right, the value is LT. And now why you need that? Because in the problem, they tell you it's the left side, right? So, okay, with these 2 tips, you should be able to get the path now. You know the answer already, that is 27532-LT, but now you have to give us the path. So we're going to count to 3, so you can pause the video and give us the path. 1, 2, 3. Okay, let's do the whole summary of the problem. This is a surgery musculoskeletal procedure. The patient presents to the emergency room following a fall. X-rays were ordered for the lower leg, and results showed a fracture of the proximal left tibia. The emergency room physician performed a close manipulation of the fracture with skeletal traction. There's only one code, and the code 1 through the index is found like this. First you go to index.
Go to index.
Then you go to manipulation.
Manipulation.
Then you go to dislocation and or fracture.
Dislocation and or fracture, right? And we have fracture, that's why we choose that. And then
we go to tibia.
Tibia, and you get how many codes?
You get 5 codes.
5 codes. Those are the codes that you get. Now, the code number 1 through tabular is found like this.
Right.
First
you go to tabular.
Tabular, and then you're going to check all the codes that you found in index, right?
Yes.
Okay.
Then you go to 27532.
What is that?
Close treatment of tibial fracture, proximal, with or without manipulation, with skeletal traction.
Right. Now the second one, what is it?
27752. Close treatment that goes on, shaft fracture,
manipulation, right? Yes. And next one?
27762, medial malleolus.
Malleolus.
Then the next one, 27768, posterior malleolus.
Okay.
And then 27825, weight bearing.
All right. Why don't you erase these clusters maybe, because we don't need that. We only dismissing that code because it's a shaft fracture. So we're just gonna leave what we're using to dismiss the code, right? Okay, then in the end, it is an equal sign, right? Which means that we double check this code. Why? Because we go back to the 27532, which is the closest one that we have to our problem, right? So that's the code. Now, we need a modifier. Can you read what it says there?
Okay. Add the modifier LT, left side of the body, because it is the left side.
It is the left side. The problem tells you that it is the left side. So the code, the answer is 27532-LT. Okay? Thanks for watching, and don't forget to visit our website. Thank you.